Okay. Well, welcome everyone. My name is Haley Figueroa here at the DPS Substance Use Prevention Program, and we host this monthly webinar to feature different prevention topics that you may be interested in for your children. So really excited about what we're offering today. So we are going to have about a 45-minute webinar with Dr. Christian Thurstone, who I will introduce here in a moment. And then that will be followed by about 15 minutes of Q&A. We do have Spanish interpretation. Raul is here and just announced how to connect with that, which is the bottom button at the bottom of the screen. We will be sharing out Dr. Thurstone's slides as well as a recording that will come from my colleague Leah through an email, as well as be put on our website, which is dpsprevention.org. So again, just excited to have Dr. Thurstone here with us, who is a dual certified in addictions and child psychiatry. He's also the medical director of the Denver Health STEP program, which serves adolescents in our community who are struggling with substance abuse issues. We also have the 19 school-based Denver Health Centers here in DPS, where Denver Health often has a counselor to do treatment with our students. His leadership on best practices in substance use prevention and intervention has been a huge source of inspiration and influence on our program in DPS. So without further ado, I will hand it over to Dr. Thurstone.
Hello. Thank you so much, Haley and Raul, for being here and inviting me today. And do you hear me okay? Okay, great. And I am not able to share my video, so maybe it's denying me the access to do that. But all right, good. Haley, do you want me to share my own slides, or do you have those pulled up already?
That would be great if you could share those. And I just tried to make you co-host to see if we can allow your camera to share. Oh.
There we are. Good. All right, great. Hello everybody, and it's great to see all the people in the audience. And if looks like the chat function is enabled, so if people have chat where they want to make questions or comments to me, that would be great as well. And I can also look for hand raising, and I'll make sure I leave time at the end. And I think I'm talking until about 12:45-ish was my plan. And then that will leave plenty of time also for conversation, questions, comments, concerns that people have. So Haley, please correct me if I'm wrong on that timing there. All right, so I will go ahead and share my screen. And I have some slides, which sounds like Haley will make those publicly available, which is great. And here we are, adolescent substance treatment. And my name is Chris Thurstone. And as Haley mentioned, I'm a child psychiatrist, addiction psychiatrist. I've been here in Denver for 20 years at Denver Health, which is a beautiful place to be because we have a mission to provide care regardless of ability to pay. And as part of that, I've been able to do some work in some of the 19 school-based health centers, which is a great partnership, so innovative, between Denver Health and Denver Public Schools. And it brings me back to the beginning of my own career, which started out as a public school teacher. So I always love coming back into the schools and never say no to an opportunity to do this kind of work. So let's see, I just wanted to check in with everybody and encourage everybody to check in with themselves. This is something, if you know a little bit about me, I'm in the military, I'm in the Army Reserve, and this is something we use in the military to just check in and see how we're doing, because that can be kind of a stressful experience. And so I invite everybody to just check in to see if they feel like they're feeling green or yellow or orange or red today. And just give your space some time, yourself some space and time to feel how you feel and take care of what you need to take care of, because we know that we are in the mental health wave of the pandemic. After a natural disaster, typically the mental health effects of the natural disaster peak a year after the natural disaster. So we're right in the middle of the mental health part of this pandemic. So I invite you to do what you need to do to take care of yourself in these interesting times. This was my plan today, to talk a little bit about the adolescent brain, then to talk about substance use specifically, talk a little bit about treatment, prevention, and then make sure I leave time for all of your excellent questions, comments, concerns, and I look forward to that conversation and our time together. So first, if we're talking about the adolescent brain, and this is a really interesting story here, because we used to think that the brain was fully developed by age 6, which is about first grade, and then not much really happened after that. And that's kind of true, in that the brain develops, reaches its, close to its full weight by age 6. But then with the invention of MRI technology in the 1990s, researchers in the early 2000s began to publish really interesting studies about how the brain is maturing well into the 20s, the mid-20s, with boys a little bit delayed behind the girls with that brain development process. And you see here that the brain mostly develops from the bottom up and from the back forward. And what's really interesting about that is that in the back of the brain are things like our ability to see. So that develops pretty quickly. In the front of the brain is our parts of the brain that help us think ahead, plan ahead, say no to things, use good judgment, things like that. And that's the last thing to mature, which is really interesting, because the adolescent brain is known for having some challenges with some of those things, thinking ahead, planning ahead, things like that. And I hear parents say all the time, well, didn't you know that wasn't a very good idea? And typically, yeah, the adolescent brain knew it wasn't a great idea, but it's hard to say no. It's like driving through a yellow light, and maybe it's not a good idea to be racing through a yellow light, but you just kind of find yourself doing it anyway. And that's kind of the story of the adolescent brain. The adolescent brain, I also mentioned, it matures from the bottom up, which is a good thing, because the bottom is responsible for breathing. It's important to breathe. And then kind of the middle part of that brain is the brain reward circuit. So that matures in early adolescence. And then again, going up to the front part of the brain, top part of the brain, which is important for thinking ahead and planning ahead. So what do we have there? We have a situation in which the brain reward circuit works great. And then the part of the brain that can put the brakes on that does not work super great. So that's why substance use in adolescence is very dangerous. The adolescent brain can become addicted much easier than the adult brain. For every year we delay the onset of substance use, we improve somebody's chances of not developing an addiction. I think another thing that's really important to point out is that the adolescent brain is under construction. And anytime you add a toxin to that environment, you have the potential to completely change the way the brain is developing. And that is certainly shown to be true with animal studies. So those are the two main concerns about mixing the developing brain with substance use. A, the developing brain is more vulnerable to developing an addiction. And B, the brain being under development is more vulnerable to that developmental process being changed, altered by introducing a substance. So what is happening during this brain development process? Two things. One, connections are being pruned out that are no longer needed or used. So this is behind the whole idea that if you want to learn a language, like a second, third, fourth language, it's really great to do that when somebody's young, before some of these connections have been pruned out. Why is there pruning happening? Because the brain is becoming more efficient. And it's just not, in the best interest of the brain to keep connections that are not used or needed. Second thing that's happening during brain development is that little fat cells called myelin are developing around the nerves. And this little fat acts as insulation that helps the electricity in the nerve cells travel more efficiently. So if you think about it, electrical wires are work much better when they have a little insulation, a little coating around them. The electricity can travel more efficiently if that's the case. Same thing in the brain. So those are the two things happening in the developing brain. One, getting rid of connections no longer needed. Two, developing fat cells around the nerve cells so that the electricity travels more efficiently. I think this is an interesting slide. So marijuana, THC, the active ingredient of marijuana is THC, binds to all these little pink dots in the brain. So you can see there are a lot of marijuana, what we call receptors, cannabinoid receptors throughout the brain, especially that blue part is the brain reward circuit. Right around, kind of making a little backwards C around that blue part, has to do with the part of the brain that's important for emotions and memory. This is why marijuana really can play a role in affecting memory and learning. Lots of dots also in the back part of the brain on the right bottom part. That's really important. It's called the cerebellum, and it's really important for balance, coordination, things like that. Probably one reason of several reasons why marijuana and driving are not a good combination. Marijuana operating heavy machinery, not a good thing. I think this is an interesting slide. So I'm just inviting you to look at this slide and to think about the emotion that this person has. And I think most adults would say this man looks afraid. What's interesting is that 50% of adolescents would say this man looks angry. So again, just underscoring the point that the adolescent brain is not the same thing as the adult brain. And I think it's really important for us as adults, teachers, parents, coaches, caring adults, just to remember the adolescent brain is not functioning the same way as the adult brain. There's a really important structure in the brain called the amygdala, which helps us perceive and understand emotions. And that is not yet fully developed in adolescence. And if you work with teenagers a little bit, you probably have had this experience where teenagers perceive somebody as being mad at them, when in fact it's not really anger. It's, it's kind of something else, maybe fear or anxiety or something, but it's not necessarily anger. So-and-so's mad at me. Feels like I hear that a fair amount. All right. So moving on, talking about the different substances and substance use for adolescents and its relevance there. So this here is from the Healthy Kids Colorado survey. So teenagers who are in school, in high school, complete this survey about every other year. And they ask them, for example, did you drink 5 or more drinks in a row in the last month? Yes or no? And that would be the binge drinking one. So about 12.5% said yes. Did you use cannabis or marijuana in the last month? About 13% said yes. Did you use prescription pain pills in the last month? And that's about 6%. And did you use any nicotine vape products in the last month? And about 16% said yes. So I think what's interesting, whenever we're talking about adolescence and substance use, the top 4 really are in this order: nicotine, marijuana, alcohol, and now prescription pain pills, which is an emerging, evolving story that I want to make sure we talk about today. What are the trends in substance use among adolescents, especially in our state? So again, this is the Healthy Kids Colorado survey, surveying teenagers across the state who are in high school, asking them, did they use cannabis, yes or no, in the last month? And did they use nicotine vape in the last month, yes or no? And that's the top line there, the nicotine vape. And so it's actually a little bit good news. And I see some people on this Zoom today who are really involved in the prevention work that's being done across the state. And I just want to thank you for that, because it looks like some good things are happening, and which is just great news in the last few years. So with respect to nicotine, we used to have the highest prevalence of nicotine vape use among adolescents of any state. And that has really decreased in our state recently. So that's wonderful news. And same thing with marijuana. We used to, still are, relatively elevated in our prevalence of use of marijuana. But you can see something happened between 2019 and 2021 to where we're going in a good direction. So I hope that continues. And I'll talk more about why I think that's a good thing that teens are using less substances. I think this is an interesting slide here. There are certain subpopulations that are disproportionately affected by substance use. So this is the proportion of adolescents who use marijuana in the last month. And I'll just go through the graph here. All adolescents, 13.3. Females 13.7 compared to males 12.5, which is really interesting. Substance use used to be more prevalent among males compared to females, and that's changed in the last few years. And I think it has something to do with the commercialization and legalization of different substances. Sorry about that. Sorry about that. My phone is going off. All right, so let's see here. We have here then youth who identify as bisexual really are disproportionately affected by substance use at 24%. Gay and lesbian youth also disproportionately affected. And then as you move right here by race and ethnicity, African American youth, American Indian youth, especially disproportionately affected. So that's interesting and could have some implications around prevention work. It's also interesting to note that African American and Hispanic youth less likely to be referred to treatment or to access treatment in traditional settings, but a lot of the school-based health centers really reduce that disparity in access to care, which is really great. We have a publication that's under review about that right now. I think this is a really hot topic right now, is fentanyl. We have over 100,000 opioid deaths in the United States every year now, and that has been going up and up and up. And I personally have had 6 adolescents die of fentanyl overdose in the last 2 years. And so this is of much concern. So fentanyl is a drug that kind of does the same thing as heroin, but it's about 50 times more potent than heroin is. So it's 50 times more potent. And so that makes it easier to overdose with. And you can see here this little graphic. On the right, that amount of fentanyl is equal to that amount on the left of heroin. All right, so let's see here. Again, Overdoses among adolescents by fentanyl are up 182% pre-pandemic, and overdoses in general up over about 110% in this age group. And really interesting is that 2/3 of the adolescents who died by overdose had a bystander with them. So if that bystander had just had Narcan and known how to use it and used it, 2/3 of these deaths could have been preventable. So I think underscoring the importance of having Narcan, carrying Narcan, knowing how to use it is important. Let's see here. With respect to nicotine use, so let's see here. As I mentioned, there's the developing brain, and adding different substances to a brain that's under construction might change the way that brain develops. And sure enough, what we see is that adolescents who use nicotine have more anxiety, depression, attention impulsivity issues in adulthood. And these are actually also supported by animal studies where we can actually do this work. And similarly in animals, we find the same finding. 90% of smokers start before the age of 18. Smoking is the leading cause of preventable death in the United States. So we need to really remember about nicotine. And truthfully, we made huge gains as a country in reducing nicotine exposure, and then vaping was invented, and we're right back to where we were in the 70s and 80s with nicotine exposure in youth. So we need to really keep an eye on this. I think it also underscores my point. 90% of smokers start before the age of 18. The adolescent brain is much more vulnerable to developing an addiction than the adult brain. And unfortunately, the tobacco companies know this, and this is why they've gotten in trouble in the past for making products that can appeal to young people. And truthfully, why vaping, Juuls, has also gotten in trouble, gone sideways with the FDA for making products that are disproportionately appeal to young people with their sweet flavors and bright colors and packaging and marketing. Let's see here. So this is alcohol. So again, animal studies, human studies all support that alcohol exposure to the developing brain is not a really good thing, is a bad thing. And what can really be affected is a structure called the hippocampus, which is shown in that picture there, which is really important for learning and memory. And so alcohol exposure looks like it affects how that part of the brain specifically develops. I think it's also really interesting that adolescents are less susceptible to the motor and sedating effect of alcohol than adults. So adolescents don't typically respond the same way to alcohol that adults do. And they respond in a way that enables binge drinking to be more possible in that age group, because they don't get as sleepy and they don't get as affected with their balance, coordination, and those kinds of things. And then, we're going through kind of the big three here: alcohol, tobacco, marijuana in adolescence. Those are the ones that are disproportionately used by adolescents. 1 in 6 teens who uses marijuana develops what we call a cannabis use disorder. That's the best finding we have, best number we have, although with the newer products that are more potent, we'll need some more data on that. My hypothesis is it might be even more than that. Again, the adolescent brain is vulnerable to developing an addiction. Heavy marijuana exposure starting in adolescence can predict up to an 8-point drop in IQ. So that's if people continue using the substance for a long period of time. The finding that really disturbs me and that we're seeing a lot in the clinical world is this connection between psychosis and cannabis use. And you can see all the studies now that are supporting this, that adolescent cannabis use predicts the development of psychosis. What's that? That's some kind of break with reality, hearing things, seeing things that aren't there. Schizophrenia is an example, is just one example of a psychotic disorder. And we're really seeing this more and more clinically, it feels like. And it tends to respond differently. It doesn't tend to respond the same to the same medicines as typical psychosis is kind of what clinicians are talking about. So I think that is really concerning. We're in a school setting right now. No doubt about it. Even weekly marijuana use is strongly associated with decreased school achievement. It's associated with using other substances, 2 to 3-fold risk of using other substances. The debate about that is why is that the case? We don't know exactly why marijuana use predicts going on to use other substances. And then we're in a suicide epidemic as well. So there's clearly an association between marijuana use and depression and suicide attempt. And those are odds ratios. So adolescents who use marijuana are 37% more likely to have depression and over three times more likely to have a suicide attempt compared to adolescents who don't use marijuana. So that's concerning. Again, we have to tease out why is that the case exactly. Treatment. All right, great. So let's get into some good news. What do we do about this? Treatment and prevention issues. And short answer is there's a lot. Treatment works, prevention works. There's a lot we can do. So hopefully I can drive home those points today. Treatment. The backbone of treatment from a clinical standpoint is something we called motivational interviewing. And this is actually something that parents can be trained in as well to use with their kids. But basically what it is, I'm going to invite you to think about for a moment who your favorite teacher was. Who's the favorite teacher, coach, mentor that you've ever had? I'm just going to pause on that. Some people think, well, I'm thinking of somebody who cared, who was interesting, funny, competent, was a good listener, pushed me to do my best, kind, listened to me. So basically, when you're thinking about motivational interviewing, one can channel this favorite teacher and then be that way with the young person. Encouraging, kind, listening, empathetic, push them to be their best, interesting, funny, competent. That's what motivational interviewing is, or the spirit of it at least. We also in the STEP program is in 8 school-based health centers and growing. We just got a grant to grow that, so that's super exciting. And one thing we do in that work, I'm going to invite you to look through this list of values here and to think about maybe 2 values that you would really like to focus on for the rest of the day. So if I'm looking at this, I'm thinking about, well, I kind of like the idea of focusing on some peace and some joy today for me. And what we do in treatment is really help adolescents connect with who and what matters to them in their life. And we help them live that out no matter what the external noise can be in their lives, or even the internal noise of depression, anxiety, fear, anger, things like that, we can still choose to focus on what matters to us. So that's a lot of what we do in treatment. And then we also do family work in treatment. So here's another fun exercise. I invite you to think about winning the Powerball. And it was recently almost up to $1 million, and that was really exciting. I almost bought a ticket. So say you win the Powerball, who would be the first person that you would connect with and tell about winning the Powerball? And there's a good chance that that person is your primary attachment figure, we call your primary connection, your primary person connection in your life. And so what we do in family therapy with the adolescents we see is really try to help the teenagers have a strong connection or attachment with their caregivers, with family, with a few friends, with a higher power. We really try to have them be strongly connected. They say that smoking or that being lonely is worse for one's health than smoking 15 cigarettes a day. And loneliness is as a human being, one of our greatest fears. And so we really try to help adolescents feel connected and be connected to people who care about them. So that's treatment in a nutshell. Motivational interviewing, which is channeling our favorite teacher, our favorite DPS teachers. Acceptance and commitment therapy, we call it, which is really helping people connect to their values. And then third, the emotionally focused therapy, which really helps people connect to each other in positive ways. There are mental health clinicians in all 19 school-based health centers. There are STEPs, so specific substance treatment clinicians, at the main campus and 8 school-based health centers. We're trying to grow that. Really, we need to grow all of the mental health resources. There's just so much need. We have a new intensive outpatient program at Denver Health on the main campus for adolescent substance treatment. And we actually started this, the new adolescent detoxification program at Denver Health. And to our knowledge, it's the only one we know of in the country, definitely in the state. And I don't know of any others. So adolescents can go there for a brief detoxification experience from substances. So we're trying to develop this whole continuum of care for adolescents. It used to be that only about 3 to 6% of adolescents who needed treatment accessed treatment. And we're really working hard to change that and make it so that no one gets turned away from treatment. Nobody gets barriers to treatment and cannot access that. Prevention work. All right. So the one thing that I just want to focus on, there's a lot of work in prevention that's really good in terms of building refusal skills and changing attitudes and providing information, and a lot of good work there. Being connected to school and having academic success and being connected to a faith community. And there are a lot of protective factors. The one that keeps coming up over and over and over and over again, and the one that I think has the strongest effect size, is having a strong, warm relationship between child and caregiver. Having said that, I mean, I want to make it very clear that there can be a very strong connection and relationship, and somebody still develops an addiction. I mean, it can happen to anybody. But if there is one thing we could do to minimize the chance of that happening, it's really helping parents and children connect with each other. How does that happen? The acronym for this is ARE. So we do a lot of work to help parents be available. So are they physically reachable? Like, do they have a cell phone on them? Are they, physically in the home and can be reached? Are they responsive? So then once they're physically reachable, available, do they, and somebody calls my name, do I say, yes, I'm here? That's responsive. And then engaged. So can I show that I'm tuned in to the child's emotions? And this is kind of the trickiest part, but you can see how this mother here looks like she's really tuned in. She's on the same frequency with her child here, in terms of being present and engaged and understanding the emotions that are being connected and expressed there. So ARE, physically available, responsive, and then engaged. So engaged to me is a lot of present moment focus. Like, what a gift to be available with somebody in the moment, in the present, as opposed to thinking about what happened to me, in the past, or what I'm worrying about something in the future, but to physically be present with the person I'm with is engagement, a really important part of engagement, and a real gift. So with that, I'll finish up, and we can take questions. I'll stop sharing here. I finished a little earlier than I thought I would. All right, good. Awesome. Good. So with that, I'll finish up, and we can take questions, comments, concerns that people have. And Haley, if it's okay with you, I was able to just pull up this Q&A, and maybe I'll just go through some of these, and then we'll go from there. And I see somebody has a hand up too, Chris Woodburn. So all right, well, Haley, how do you want to do this here? Do you want to do the hands? Do you want to do the chat Q&A? I can defer to
Yeah.
you on.
Okay, great. And it looks like I'm having trouble getting my camera to come on, but no worries. I think you want to look in the Q&A and maybe start with those questions, and then we'll try to figure out here how to unmute Chris after you answer these.
All right, that sounds great. Thanks for the instruction, Haley. All right, so here we have, do you know if the Healthy Kids data shared is high school students only or high school and middle school combined? And what I shared was high school. So I think that answers that. Why do you think substance use is decreasing? What can parents do to contribute to that trend? That's such a great question here. So, okay, so it's possible this was just a one-time thing, and it's not really decreasing. So I want to see, is this a continue for another couple years or so? But why might it be decreasing? I mean, I think this is an example of it. We have Haley and her team doing all this amazing prevention work. We have all these mental health resources in schools now that we didn't used to have. I think there is awareness and traction around substances not being good for the developing adolescent brain. Actually, a big, huge one here that I need to mention is during the pandemic, we saw adolescent substance use actually decrease. Why do we think that's the case? I think it was the case because people were in their homes and not out in the world where they are exposed, can access substances easier. So I think that's a big explanation. So whereas the pandemic was terrible for adolescent mental health, adolescent girls nationally, according to the CDC, about 60% of girls have clinically significant symptoms of depression right now. And 30% of adolescent girls seriously considered suicide in the past month or in the past year. It was terrible for our mental health, but it was a little bit not bad for our for adolescent substance use because adolescents were inside, not exposed to substances as much. So that's one thing. What can parents do to contribute to that trend? I love that question. I love the idea of parents having a not a one and done drug conversation, but an ongoing substance conversation that starts in elementary school. Very simply, drugs are bad. And then middle school, it gets a little more complex in terms of things like what do you think about substances? What do you know about them already? What do your friends think about it? Do you know people who use substances? What do you want to know about substance use? Things like that. And so the conversation just gets a little trickier. I do not recommend that parents talk about their own stories with substance use until their children are also adults, because it's very easy to get misinterpreted. All right, and I do see some hand raises here, and I'll make sure we try to get to those two as well. All right, so then Henny, hello. So what was the primary substance did the children that you saw that died from fentanyl come to you for? Yeah, that's a great point. So they were in treatment with me for opioid use, and they had a period of doing really well, and then typically relapsed or went back to using and had lost their tolerance and then used too much, was one thing around that. In a couple cases, it was interesting that it looks like the youth were using methamphetamine and fentanyl mixed together. So I think that is a myth, just because you're mixing a stimulant like meth and a downer like fentanyl, that doesn't make the fentanyl safe. One can still overdose on fentanyl, even if one is mixing it with a stimulant like methamphetamine. Let's see here. I think, and then another thing about that too is that several of the kids who passed away had real pressure to complete treatment, to not take medication assisted treatment. And in retrospect, that was, I believe, a mistake, to try to leave treatment, to stop medications prematurely. And I will say that the teens who we do give out fentanyl test strips, and I am supportive of that, and teens do use them, and that's a good thing. And we can talk more about that. The teens who died, who were in my care, were likely, I believe, knew that they were using some kind of opioid or fentanyl. All right. So how can youth and parents get Narcan? Is it available at Denver Health? That's a great question. So Narcan is supposed to be available at pharmacies without a specific prescription. So I think that's it. There's been a lot of talk of making it available over the counter. So I would go to, like a Walgreens, CVS, or local pharmacy and ask a pharmacist, hey, how can I access this? In the STEP program, the Adolescent Substance Treatment Program at Denver Health, we do sometimes give out Narcan, and sometimes we write a prescription for it. We make sure that all parents have it. And there is a website. If you can Google like free Narcan Denver, Colorado, you can order some Narcan from public health departments as well. So those are at least some ways. And yes, I definitely recommend carrying it and knowing how to use it. There's an app called OPI Rescue, and that will teach people how to use Narcan and hopefully help people feel comfortable. And yes, I have had to use my Narcan and am, very, 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 very glad that I had it with me and knew how to use it. And it is pretty amazing how it works. All right. And if somebody is passed out because of if somebody's passed out for any reason, Narcan will not hurt them. So if somebody's passed out because they've had a stroke or a heart attack or something like that, Narcan will not do harm. All right. Do you have any guidance or suggestions for parents, guardians of middle school students in navigating conversations around fentanyl? Yeah. All right. So I think that in middle school, it's okay to be a little bit more directive, clear in this. Like, fentanyl is really terrible. What do you know about it? I think is a great way to get into this. And then I think it could be great to communicate like um, and this is one reason why you don't want to use any substances, because you never know if they have fentanyl on them or not, if they're contaminated. And it could be an opportunity to also say very clearly, never take someone else's pill or medicine. Like, what can cure one person can kill another person. I think it's also an opportunity to, in middle school time, when somebody's a toddler, you put all the pills and things up out of reach. Middle school, now's the time really to lock that stuff up, get it out of the house if possible. Even if you trust your own children, can you trust their friends not to look through your cabinets and your medicine cabinets? Okay, hopefully that was helpful. These are great questions. Please keep them coming. Thank you for the questions. How do you recommend to teens talk about how they are feeling? How do you recommend talking to teens about how they are feeling? This is a great question. I was just talking, I have a clinical supervisor that I meet with, and I present cases to, and I meet with, and I plan to do this as long as I'm practicing medicine. And that's the thing about the teenage brain. If you ask the teenage brain, how are you feeling today? What are they going to say? They're going to say, fine, I don't know, something like that. There's something about very open-ended questions that are just too much for the circuits of the adolescent brain. So one thing I think is really helpful is to try to take educated guesses about how they might be feeling. So I can imagine that's really stressful. I can imagine that must be so exciting to win this, game, or to have this success in your life, or this must be so stressful to have your friends arguing with each other, or you must be really mad about that. Um, so that's kind of where I land with that, is to, instead of asking a question, use a reflection that's kind of an educated guess. You're trying to pick up on that emotion for them, and then help them like expand on that work. I'm just trying to think on that. It's such a great question. It's a 20, we could do a whole session on that. How do you talk with your teens about emotions? One thing I do like, I'm going to guess that Haley and her team might have some trainings even around this. And so maybe we'll get into that. But there's also something called emotion coaching. And you can Google that and find out some more information about that. All right, so is Narcan and training available to educators? And so maybe with that, Haley, are you available? Do you want to say what the Narcan resources are at DPS?
Sure. Yeah. Hi, Chris. So our nurses in our DPS buildings are all stocking Narcan in their school nursing offices in a central location, and they're all in charge of training related to how people are to administer Narcan if needed to students. So one of the things that they did stress is that if there is a need for Narcan, that the building Narcan would be used, that's stocked, because that, I guess, is the way the rules are around storing medications. But there is a protocol for that, and nursing department at DPS is sort of taking the lead on that. But it's really exciting because at this point there should be Narcan in every building.
That's awesome, Haley. And then do you also want to comment on talking with kids about their emotions, and if there are any resources that you have around that?
Yes, one last thing on fentanyl is we are hosting a event at TJ that I think is coming up here on October 10th in the evening, where we're going to be Megan Michio is going to be hosting that, along with we're going to have a panel. There should be Narcan on site from one of our community partners as well. So we'll definitely be pushing out information related to kind of what our team's doing. We've been hosting those fentanyl conversations regionally. Just love the discussion around feelings and helping our teens identify their feelings. And I always, we're being trained and doing a lot of trauma focused CBT. And one of the exercises I've been doing with my students is just talking about how some feelings are easier to talk about than others. And we tend to hide certain feelings. And I just think all of that discussion around building their emotional vocabularies is so important. And my own teens, I'm parenting 3 teens right now. And I feel like, gosh, when I want to talk to them, they don't really want to talk to me. So I feel like just trying to have that openness for the 10 o'clock at night when they come in and say, this happened today. So I think just like staying open and, like you were saying, really, building that warm relationship where, yeah. And I loved what you said, just to echo the piece about kind of taking a guess of like where they're coming from, or having that piece. So I know our team is really strong in working on those pieces, and just love that question came up.
That's awesome. Thank you, Haley. So yeah, that fentanyl panel should be dynamite. So hopefully people can make it to that. Let's see here. Can you address peer groups and their role in substance use? What are some red flags? So I love this question here. So we do use peer groups in recovery, and there are just certain things that teens can hear from their peers that is hard for them to hear from me. So a couple thoughts on that. We try to moderate these peer groups pretty carefully, because they can go sideways fast. So we try to have some ground rules. We try to have some understanding that people are in there for recovery purposes, and we try to monitor them closely, because there can be some risk. And there are some really nice peer recovery resources in the community that are 12-step based. I'm thinking of like the Full Circle program that we partner with a fair amount, and some other resources. So those are some initial thoughts. Haley, anything else on that one?
Yeah, good question. So, we have a list of resources, obviously, that we refer to. But in terms of, peer groups and sort of red flags, right? Like, I just always encourage parents to just be understanding what their kids are doing, and, who their peers are. And gosh, I've just seen it with my own kids, how important it is. And with the students that I work with, their peer group. So just understanding and letting them know that influence and that piece that they have on them, I think is really important.
Haley, thank you, because I misread the question. I was thinking too clinically, right? But yes, having peers who use substances is a risk factor for kids using substances. Having an older sibling who uses substances is a risk factor. And so definitely it's a big influence for peers, for students, and need to pay attention to that. So thank you. Let's see here. You discussed that the brain development makes saying no hard. What advice to give to parents and kids on this? So good. All right. So let's see here. First is the awareness of it. The adolescent brain is not the adult brain. So when you're tempted to say, didn't you know, or when you're tempted to get really frustrated, hopefully you can remember, oh yeah, I'm dealing with an adolescent brain, not an adult brain. And that means logic is kind of out the door. And I think that would be another thing. There's the awareness, and then there's also logic does not necessarily apply. So I hear all the time, and then I told them, and then I told them, and then I told them, and I don't understand. I told them. And so logic and reasoning and lots of words do not help the adolescent brain. So I do recommend being that, well, ARE, being available, responsive, picking up on the emotions, helping kids understand their emotions, and B, keeping the advice and the logic and reasoning very short and succinct, because the attention span is not long. All right, good. So DPS Sustainability is partnering with DDPHE on a vape turn-in campaign. Oh, cool. We would like to connect with all relevant departments and interested schools and educators. Please email Department Sustainability at dpsk12.net. And Chris, thank you so much for your patience. I know you had your hand raised and everything, so I'm glad I could say that.
And I think we can actually unmute Chris, Dr. Thurstone, if we're going to try to do that. And I know, Chris, we have a time, Leah has time to meet with you. So excited about partnering with you on that.
Oh, yeah, thank you. I think we're excited about this. We just want to make sure this is our first vape turn-in campaign we've ever done. We do it the right way, and we loop in nursing services and anyone else who needs to be involved. But our department would be in charge of delivering the boxes and picking them up once they have deposits in them. But I think, yeah, and then we also want to extend it to educators, so employee wellness as well.
Chris, that's great stuff. Thank you for your patience and for speaking up. And I'd love to partner with that as well in the STEP program, you know, in our clinical spaces, if that's possible. So we are nearing the end of time here. So I'll just take this one and then I'll turn it back over to Haley to wrap us up. I'm thinking more about new friends and influence on drug experimentation. And yeah, so like we talked about, friends can be very helpful and then can be less helpful in the substance prevention space. We know that can definitely be a risk factor. Is there somewhere families can turn in unused pain medications? Is there an expired or unused pain medication drop-off location in hospitals? I know Denver Health outside their pharmacies has drop boxes for this. And then every so often their community take back events for this are at least two options around that. So yeah, that's important to be thinking about, and that is the standard recommendation, to dispose properly of unused medications. You know, a lot of people want to keep all that stuff because what if I need it or something, but really it presents more harm than good by being available to somebody who could misuse it. So thank you for bringing that up. With that, we're pretty much out of time. So thank you all for your attendance, for your questions and everything. This was really delightful. And Haley, I'll turn it back over to you to wrap us up.
Wonderful. Thank you so much for taking the time to do this. It really means so much to us. And thank you everyone for attending. Look out for an email with a survey link, as well as the recording and